Sanmonani, hi guys. Today I want us to speak about ear infections. Amadlebe aphuma amanzi noma ubovu. We have different types in that road. Kunamadlebe aphuma amanzi, or yes, aphuma amanzi, and we call them swimmers' ears because adubhukuda kwangena amanzi or adugeza eshaweni kwangena amanzi. That is the easy one. We treat will give you antibiotics and ear drops, and that should be resolved. And then we have ear infections that are common now in babies. In Ghana, most of the time it is common because they will get ear infections, especially in winter. Or a baby that is on a feeding, because of the position mabelala sibalalisa phansi or yena ayithathe ingcine yakhe ayilalele without a pillow to support umqala wakhe, so that engeke alale aqonde phansi. Umntwana needs to lie in and what we call it 90 degrees angle, so that kube nento emsupportayo emqaleni, because there is a eustachian tube here endlebeni, a connector with your throat. If you're blowing your nose right now, blow it hard, you will hear umoya uphuma ngamadlebe nangamehlo. That is because there is that tube that is connected between the ear and the throat. So anything that is going down the throat could possibly easily go to the ear if the position is not right, especially in children, because we eustachian tube wabo or abantu abadala will be like this, while wengane usami kanje usazobuyushintsha na ubheke phansi. So make sure the lying position of the child is correct to prevent all those things. If then umntwana incane yakhe elele, that is when they're getting this fluid in the ear canal, and then basic build up kube ear infection, or they're just getting a pure normal ear infection just because of the cold and the flu. A cold and flu, upper respiratory infections again, good infection empinjeni, okay, that will cause again that joining there, and then the fluid is going straight to the ear, then you're getting the ear infection. Again, a doctor will give antibiotics on this one, maybe some ear drops as well, nama painkillers for the pain. You should be fine. But make sure that it is attended to. There is this lack or yokuthi umntwana angayiswa eclinic okadokotela just because une ear infection. It's like, it's common, ahlale emphatha amadlebe. We don't know when it is chronic, ne? You don't know when it will become chronic. Some people ababebesa recover from that period. Uthola ukuthi usehlale ephathwa amadlebe ngisho semdala unamadlebe aphuma amanzi aphuma ubovu. Now that is damaging to the ear. Ear infections are a temporal hearing loss, meaning you will have a hearing problem just because you have an infection. Once it clears off, you have normal hearing again. But if this is not treated, if it is left untreated and for a very long time, it can turn to a permanent hearing loss. For a child who was born or infection before 2 years, ukula unama infection until they 3, 4, 5, 6, if that child is tested, hearing yake will not be normal again, ne? Because it's been very long with this chronic ear infection, ibuya recurring, coming back, going, coming back, going. So we need to attend to them, have them treated. If we treatment the doctors will know what to do. They will give you options like grommets, go have surgery, they go to grommets, they put a tube to balance the fluid because sometimes this behind the eardrum. So we need to clear off that part in the ear, fluid, so doctors would give you options of what needs to be done to help. Once ear infections was the eardrum, that is called a perforated eardrum, then you need the surgery again to repair the eardrum. Doctors again will know when to repair and when not to repair. Some, it's not advised to repair to damage is too much, or it's an adult. With adults, it becomes really difficult to repair because it is expected after a repair in lebe normally will grow itself back in normal again. But with adults now, this repair is a bit tricky because I second ukuthi uphinde ube ne-regrow again ezokwenzeka. So it's like even i-surgery ends, but hopefully uzoba right. You know, when something is done like that, hopefully you'll be fine. So but it is important to be seen by a clinic or dokotela so that they can advise you further with what needs to be done to treat ear infections well. And then we have people that are HIV positive. HIV positive yenza ube ne-low immune system. Low immune system wenza ube susceptible to diseases, meaning uba, oh God, English in Zulu, uba at high risk ne, yes, usemathubeni amaningi ukuthola izifo ezihlukene. This is an infection, ear infection, like any other infection. Because of the low immune system, this is very highly possible ukuthi ube nama-ear infections because of your HIV status. This is common. Now there is treatment part of it. People are taking treatment. If you adhere with treatment, taking your treatment correctly every day, all the time, you know your viral load should be undetectable or very high. Then there it's not, you're more like similar to the normal person. It's not like when on a low immune system, because now HIV positive, you're taking your treatment, so right. But for the person ongekho compliant with treatment, or for the person ongakatesti HIV status ongazazi yena ukuthi umiphi, you find that treatment amandla bakhe lokho ephuma ubovu, uhlale uza, uhlale kuphuma ubovu juza, it because akufanele treatwe ne. But now it becomes tricky again. If isike yaqala leyo process, uthola ukuthi ayisalapheki kalula. Akuseyona into esizofika sithi quick fix, antibiotics, cold stuff, ear drops, so right. Uzoyithola usuyi-chronic patient, you keep on coming back because amadlebe akho ayaqhubeka ayakuza, ayaphuma ubovu, aqala before you started treatment. Even though usuyidla treatment, uyithola ukuthi usuyi-chronic of ear infections. But again, it doesn't stop you from going esibhedlela or clinic ukuthi uyothola usizo. It's very important that we attend to it. It's a temporal hearing problem, like I said before, but if it is left untreated for a very long time, it can easily turn into a permanent hearing loss. So to make sure that we're safe, just go. That is the best thing you can do for yourself. And this thing is very bad because it affects your self-esteem, especially masumdalane, because you notice I discharge, so, and the smell is not nice. It's not nice at all. So because of that, it will affect your low self-esteem. Sometimes because you're so used to it, you can't tell when it's coming. Like how is this or hey, look, there's something coming out of your ear. So that's why it's important that we attend to it, we get help before it becomes a problem. But once it is a problem again, be seen by doctors esibhedlela. They will know what to do. They will advise you better. Or we manage it like that inkinga yakho ingazibe inkinga too much for yourself or for your self-esteem. When a hearing problem, it affects in so many ways and levels. So that is in a nutshell ear infections. All right, thank you guys. Okay.